Hi, I'm Colin Hung with Healthcare IT Today, where we explore the latest trends and interesting stories in health IT. On today's episode, we're going to be talking about data analytics, machine learning, AI, and all of that, and how to bring that all together in healthcare. And with me is Dr. Steve Kearney, who is the Global Medical Director for SAS. Dr. Kearney, welcome to the program.
Thank you so much. It's great to be here and great to have you here in Orlando.
Yeah, it is. I mean, being from Toronto, coming to Orlando is always a good time because it's much, much warmer here than it is back at home.
Right.
And yeah, I'm really kind of curious because this is my first time at the SAS Innovate conference, and just learning everything that you're doing in healthcare. It has been really fascinating. But for our audience, can you maybe share some of the things that you're doing in healthcare?
Sure. So, SAS is the world leader in analytics. And so as we look across industries, we realize healthcare was really far behind. And so, healthcare struggles even with descriptive analytics or descriptive data,
Sure.
much less true analytics. And so really as we talk about the opportunity and how do you build on that, we realize that with our greatest technology like VIA that's currently out there that can do text analytics, machine learning, use image data, computer vision. But the challenge with that is it didn't look and feel like healthcare. Didn't look and feel like life sciences. And so we've been working with our SAS health teams and we've really invested across the organization, as you heard from Dr. Goodnight this morning, to really bring that usability and that operational focus to the end user. So whether you're a clinician, you're working in population health, you're a payer, you're the government entity that's trying to work, a Ministry of Health around the world, we're trying to meet you where you are. We're realizing that we have to do low code, no code in many instances because they don't have the resources. Sure. And so we want them to scale fast if they're trying to scale in the cloud. We also want to meet them where they are with the coders, right? So if you have someone who's really heads down in Python and open source code, please feel free, bring it in. And what we found is we're that trusted third-party arbiter where they look at an open source model, a SaaS model, and then they put those together and they try to determine what that looks like and what's the best to use. But then most importantly, how do you operationalize it? How do you put it into the environment where you're trying to change those behaviors? Yeah.
So what are some of the use cases that someone would have for the SAS VIA product? I mean, we've seen, or I've heard at least here, some interesting use cases from some large healthcare organizations, but maybe you can share with us what are the interesting applications that you've seen for your solution.
Sure, and we just had a number of them on stage, right? So Healthy Nevada was on stage talking about the great work that they're doing, where they actually have genomic data from their citizens, over 50,000 citizens in the state of Nevada. They also had Renown Health, which is a great partner as the health system looking at their clinical data. And then they had the Desert Research Institute that was looking at environmental data. So if you have your genomic data, your environmental data, and your healthcare data, you start looking at preventive screenings, you look at propensity scoring as far as you're going to actually develop this type of illness over time and being preventive, and then also understanding those therapies and how they impact that population. And so it's a tremendous opportunity, but it's very difficult to do. Bringing those different data sets together, having the ingestion, the data governance, to be able to look at all the different models you would run in different types of areas for healthcare, and then making sure that you have a trusted environment, you look at bias, you have that transparent accountability and the explainability, which in the health system is really hard because if they don't trust the models, they don't trust the data, then it's a problem. And then most importantly, keeping the patient at the center of it so that the patient understands what's going on. And there's so many accounts now of patients saying, I didn't know I had that condition or that my family were predisposed for that condition. And now I actually have not only the identification of whatever disease it is, but a health system that focuses on that and gets me in early and does this work in a timely fashion. But then what were the environmental factors that drove to this? So that then it's a full scale of private-public partnership that then is really changing that environment for that patient population.
I want to touch on something you mentioned there, which is a perennial challenge for us in healthcare. Getting all of those discrete data sources to actually talk to each other or consolidate them into a single set so you can actually use it for the AI engine or the analytics that you want to run against it. What is SAS doing to help healthcare organizations bring all that disparate data together?
Sure. So we've had to do a number of things. So, we've been the world leader in analytics for over 47 years now. But we realized we had to understand data very well and understand the ways that that data could be connected. And also trust it, because in the healthcare space, some of it needs to be de-identified. So we actually have an entire library now of connectors. And we said, well, it's not just good enough to have the library of connectors. How do you actually put them into a solution so you make it easier? And so FHIR is the rage for everyone now, whether you're talking about claims data and price transparency from the payer side, or if you're talking about on the healthcare side, what that looks like coming from all these different healthcare resources. Or if you're talking HIEs, the way that the health information exchanges have changed to adopt that standard. And so, our SaaS health platform actually has a FHIR ingestion model that goes into a common data model, so that then you bring that data together and you can understand and compare across all of those different data sets, the key indicators you need, and then do the analytics on it, the trusted analytics that you can implement wherever you would, in the population health space, in the true clinical space, in the policy space, so across the full ecosystem.
Now, one of the reasons why healthcare organizations are bringing the data together is, yes, you've said analytics, and we definitely love our analytics in healthcare. But of course, all the rage and all the conversation right now is around AI and AI algorithms, and that's a reason why I might need a large data set to train an AI algorithm. Talk to me a little bit about what SAS is doing in that arena and helping organizations like Duke and others with their AI initiatives.
Sure, and SAS is a proud founding member of the Coalition for Health AI. And so with MITRE, Dr. Anderson at MITRE, that brought the organizations together, Dr. John Halumka from Mayo Clinic, and then Dr. Michael Pincina from Duke, these co-founders got together and said, wow, with all of this that's going on in generative AI, AI in general, we need guidelines, we need parameters, we need transparency. And one of our breakout sessions today, they were talking about the model card work that SAS does. And those model cards look like the side of a cereal box. So you can actually understand what the ingredients are and make good choices, right? Whether it's a over-sweetened cereal or not, right? But really it's the transparency. What would that model look like and how you implement it? So there are a number of partners now, including Microsoft, which is one of the SAS partners, that's working in this space to say, wow, the bias that's in this area, the opportunity for bias. We're also working with the partners from the US government. And so as part of this Coalition for Health AI, we have ONC, we have FDA, CMS, all the groups, NIST, all the groups that would be out there making these regulations. And so they're listening, they're putting together guidelines. They have the clinicians at the table. Change Healthcare, which is a great partner, is at the table as well. And now after, we just had a summit on SAS Campus May 1st and 2nd, and so now we have a number of new members that are saying, where would AI be applied in the health ecosystem? How do we make sure it's safe? Above all else, do no harm, and that we're solving for the things we need to solve for, right? Because we could use generative AI to write a great dissertation, right? But unfortunately, if the data is not accurate, and if we can't operationalize it, we're still just doing an academic exercise. Sure. We really want to operationalize this so that at the end of the day, the patient is at the center and benefits from this.
One of the biggest gaps that I see between us and the use of AI in healthcare is the trust gap as
Yes.
opposed to the technology gap. What, if anything, is going to help bridge that gap? Because clinicians today, I think, are healthily skeptical of the use of AI, especially for anything clinical. And I certainly don't think anyone yet trusts AI to do diagnoses. But how can we get there when those engines are ready, when they're properly trained? What has to happen in order to build that trust?
Sure, it's interesting because we actually do have some clinical groups. So we have Erasmus Medical Center that's actually here at our Innovate conference today from the Netherlands. And so what happened in that space was when they were looking at their patient populations, whether it's the ICU or discharging those patient populations, they had their best clinicians that then worked in that space, and then they published those models so everyone could see them. They validated those models the same way you do with the rigor of a clinical trial and anything else. And so it was out there in the domain, people understood it, they asked questions, and then when they ran those models, everyone across their health system then trusted that because it had the rigor behind it. It wasn't a black box model. It was a model that they said, and by the way, they're using SAS, and they said across the ecosystem, we needed to understand from the time the data was ingested until that model was not only deployed, but then there were problems with the model, and we could change it. We could change the parameters, or those parameters changed over time. And they actually have gone on record saying this was the only environment and platform that we could find that could do all of those things currently. To your point, there are a lot of great components of generative AI and pockets within the health ecosystem, but right now there's a real struggle on how do you bring that together, how do you make it transparent, and then how do you implement it?
Right, exactly. Like right now, I think a lot of AI is deployed around workflow issues, administrative issues. It's looking for fraud and claims data. It's maybe looking at images and saying, hey, you might want to prioritize these images to look at, but it is not actually doing the diagnosis or the detection.
That's right.
It's just pointing some of these things out. I think healthcare is very accepting of that form of AI, but we're not yet at the one where it's at the bedside.
Well, and we talk about human in the loop or human out of the loop, right? And so with all of these, our guidance is the clinician has to be in the loop. And the clinician has to be able to then make those ultimate decisions. So if we look at, for example, Amsterdam University Medical Center, they're actually using our computer vision and AI models to look at tumors and metastatic tumors, right? But the difference is it helps them go through all of the benign ones that they had spent so much time on before. And then it also changed the way they actually reviewed those tumors, because now they can actually look at total volume and actually change the morphology and what that looks like in a true, where we've laid parameters on it so you can measure it numerically. Before, unfortunately, there was a 50% failure rate in the examination in those models.
Sure.
And so now with advanced analytics, computer vision, they can make better choices. And they can decide, I can actually do surgery on this patient, or I can need to do more chemotherapy to reduce the size of the tumor. So they are doing that, but again, it's the human in the loop, and it had to be a trusted environment where when they trained the models, everyone in that system then trusted those models, right? And again, that goes back to the data question you had. You have to really be able to trust that data. You have to trust that it looks like your patient population, you can apply to that patient population. So to your point, we're going to see a lot of workflow type things, which I think is fantastic, right? We should be looking at those things going, how do we keep those clinicians from doing all that documentation and all of the other things that they have to do after shifts, and whether you're talking about nurse burnout and all the things that are happening there. Absolutely. AI would be incredible in that. The other part of that, though, is the training set that it learns from. A finite training set specific to those use cases is really important. When that generative AI, though, can go and bring other data into those use cases, that's when you get in trouble, right? So if we search the entire internet, we're going to find strange things that we would apply that don't actually make sense for healthcare.
For that context of...
For the context of what you're trying to do with that patient.
Right, yeah. Right. You have a very unique position in the industry. You get a chance to work with a lot of different organizations, payers, providers, pharmaceutical companies,
that's right.
Research organizations. Of all of the organizations that you've worked with or seen, are there any use cases for what you're doing that are really exciting for you?
Well, I'll tell you, the unfortunate thing about COVID was we realized it was laid bare all the challenges we had in public health, all the challenges we had in drug discovery. Mm-hmm. The great thing, though, that we've seen is then people looked at that and said, how do we come together? How do we stand up environments within hours for a Ministry of Health in Germany or Spain or somewhere like that? And so we've been encouraged by people saying, oh wow, we would have never adopted this before, but now we realize we can't go back to the way things used to be.
For sure.
Right? So if we look at drug repurposing at the FDA, being able to go through all that massive data sets of clinical trials, generative AI or traditional text analytics that we do and others do, right? We had time to value, significant time to value. If we looked at drug discovery, when we were talking about how do you accelerate your compute power, right? How do you really get into that space and say, and we've been saying this for years, you haven't turned on the full potential of those analytic environments. And when they did, one customer said, we did drug discovery and evaluation in 2 months what it used to take us 2 years, right? So those are the exciting things that we're seeing, is how are they applying it, how do they make it operational, and then how are they bringing it into their workflow. The team at Duke is looking at this across all of their platforms and saying, wow, for the nursing problems that we have, the other groups that we're working with, how do we evaluate this? How do we truly evaluate patient outcomes? And so they're bringing all these teams together, and I think that's been the other key, right? Analytics are great, but most of the time it's not a technology problem, right? It's a trust problem, and it's a usability problem. And so if they trust that you are that third party that can validate it and then say, wow, this is what we think, and you can then look at that and make your own choices, then people will make good choices, right? We like to say that we provide analytics in the moments that really count, right? And we can think of no more than whether it's drug discovery or at the patient bedside or other areas where it counts the most, and that's why we're excited about just the opportunity of moving this forward. We see this growing exponentially. Everyone is saying, how do we become trusted partners? How do we work together? How can you kind of be SaaS, be that third-party arbiter that kind of says, look across the ecosystem and tell us what good looks like? And so, yes, I have a great job of doing that every day. And so there are some tremendous opportunities here.
Dr. Kearney, you've shared a lot of great information with us today on this program. Where can people go to find more information about SaaS?
Sure. So if you just go to our webpage at SaaS.com, or you can actually look for SaaS Health. And so we have a number of those, and we're actually going to launch a new campaign around some of the SaaS Health platform in September, and we're also going to launch it at our Explore with our user group there that's going to be in Las Vegas. And so we're going to actually have people hands-on there learning what this looks like with the new low-code, no-code, but if people also want to code, they can code all day long if they like. We have so many people now that are actually coding in open source, and people are saying, what are they doing? I'm like, well, they're actually leveraging their open source in SaaS to drive time to value. And so that's what we want everyone to do, to democratize the analytics and really provide it to everyone in the health ecosystem.
Amazing. Well, Dr. Kearney, thank you so much for your time today. I really appreciate you being on the program.
It's great to be here. Thanks for having me.
Hey, if you enjoyed this content and would like to find more, go to healthcareitttoday.com. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.